Hi, this is Dr. Boris Volshteyn. I'm a board-certified plastic surgeon, and for the last decade I've been dealing with gynecomastia issues and treating gynecomastia patients. And today's patient is a very different one. Today's patient is very educated. They go on the internet. They commonly know more about gynecomastia surgery than some doctors. And unfortunately, the same degree of knowledge introduces a certain degree of confusion. And we see the patients in the office that sometimes so overwhelmed with information about the gynecomastia that sometimes they get very focused on the latest and greatest techniques, hoping that they will accomplish everything. Unfortunately, it rather introduces a great degree of confusion rather than provides the patient with sort of straightforward plan of action. So the purpose of this video is help you to look at gynecomastia from a standpoint of a surgeon, so that you understand how we, or at least how I, look at gynecomastia. The gynecomastia, as you know, is enlargement of the breast, and it involves glandular tissues, which is breast tissue itself, and the fatty tissue around it. What commonly we forget that as the gynecomastia occurs, it also stretches the skin, it stretches areola, and introduces asymmetry in the chest wall shape. So when I look at gynecomastia patient, I'm usually focused on five things. One is how much excessive fatty tissue we have, how much glandular tissue we have, and whether it creates any problems, pain, discomfort, shape distortion, and so forth. What's happening with the skin? Does the skin need to be shrunk? What happens with the shape of the areola, the round part? What's the position? Is it symmetric? And finally, what's the size and shape of the nipple itself? So when we decide to determine the surgical plan and what we need to do with surgery, each of those individual issues usually need to be addressed in order to get a good result. So when we're trying to remove fatty tissue alone, that's when we use either traditional liposuction techniques with a cannula, or we use a modification of those known as power lipo, tickle lipo, and so forth. But in essence, it's the same surgery. If we need to remove the fat and try to tighten the skin on top, then we have to add more advanced techniques like laser, like smart lipo, which allows us additional skin tightening, and vaser, which is ultrasound-based technique. What it does, it melts the fatty tissue and then allows additional skin tightening on top of what happens when we just remove the volume. So those techniques allows us to do the skin tightening and removal of the fatty tissue. And it's important to remember that the fatty tissue needs to be removed not only from the breast, but also we need to define the outer edge of the pectoralis muscle, and as well as go into the side of the chest commonly to allow better overall shape and transition from the side to the front of the chest wall. The next is glandular tissue. And the glandular tissue can be removed only with two methods. One is open method, where we make a semicircular incision underneath the areola, and then we remove that tissue with either electric cautery, laser, or with scissors or knives. And the second is called scarless or no scar techniques, when we use a cartilage shaver. And what a cartilage shaver is, it's a little tube with a blade that looks like this, and it moves back and forth. So as we slide that blade underneath the glandular tissue, we shave it off, because it cannot be removed with regular liposuction or vaser or laser. And that is the way to remove the glandular tissue. So if your main concerns are just the volume of fatty tissue and the volume of breast tissue, that usually is enough. The next things to consider is, do we need additional skin tightening? So then we can use vaser or laser on top, not for the purposes of reduction of fat, but for the purposes of stimulating additional skin tightening. Now let's talk about the areola. Areola is a pigmented part. It's not the nipple itself, it's a round pigmented part in our chest wall. As the chest wall stretches as a result of gynecomastia, the areola also stretches out, becomes so-called puffy. So commonly what we need to do, in addition to removing the fat and glandular tissue, we also need to shrink the size of the areola. Sometimes areolas can be asymmetric, one can be larger than the other, so different techniques or different strength or methods may need to be used to improve the symmetry. And to do that, we can use internal techniques when we put a suture called purse string suture underneath, or we can weave the suture from the surface, or sometimes we have to make an incision around to create a defined shape of the areola. And I think one of the most understated topics in gynecomastia is the shape, size, and position of the nipple itself. What we commonly see is when the glandular tissue is removed, or breast tissue is removed from right underneath the nipple splays out, so it becomes flat. And even when everything heals, the nipple cannot really come up anymore. So the only way to correct that is actually do an open technique when we go in underneath and we bring the bases of the nipple together, recreating the volume of the nipple so it looks more normal and natural. So whenever you're shopping on the internet for the best gynecomastia surgeon, you need to make sure that you don't get lost in those various techniques of laser, vaser, endoscopic, or so forth. You need to make sure you understand what each one of those techniques is able to accomplish. So you have the fatty tissue, you have glandular or breast tissue, skin tightening, size and shape of the areola, and size and shape of the nipple. If you have more questions, feel free to contact our office. If you're interested, we're happy to make you an appointment. Otherwise, hope you find this video helpful, and thank you for your time.